Dr. Gupta, I want to go. Jonathan took us through almost everything that they're announcing today. I want to take you through one more that is on the minds, I think, of parents. And I have pressed this White House for information most days about kids, because you are hearing more stories. But anecdotally, they maintain that something that David Leonhardt of the New York Times has written about, that the risk to young kids is still less than the risk of being in a pool or being in a car accident. But I want to read what they're announcing today for adolescents 12 and over. Today, the president will, in an effort to get more kids 12 and older vaccinated, call on school districts nationwide to host at least one pop-up vaccination clinic over the coming weeks. And the administration is directing pharmacies in the federal pharmacy program to prioritize this and to work with school districts across the country to host vaccination clinics at schools and colleges. In March, the Biden administration prioritized K-12 educators, school staff, and child care workers for vaccinations. This directive worked. Today, almost 90% of educators and school staff are vaccinated. The president believes that every student, no matter their zip code, should have an easy and accessible way to get vaccinated. Vaccination is our leading public health strategy to end the COVID pandemic. Obviously, on the minds of people all across the political spectrum is back to school. And I wonder what your assessment is of this measure and of the risk to our kids in the school year.
Good afternoon, Nicolle. I love it, because what we do know from both the private sector and public sector is that proximity, ideally on-site vaccination clinics, is vital to increasing uptake of the vaccine. I would like, and I'm hoping that we'll hear this from the Biden administration. He's talking, as Jonathan mentioned, he's talking about introducing friction. You don't get the vaccine, you're going to have to mask up and test. That's a great strategy. We know that helps with uptake. But we need direct engagement, Nicolle. I think we've underestimated the willingness of those unvaccinated to get vaccinated if they have their questions addressed directly. I've seen it directly from folks back home in Ohio, for example, where you would think maybe there's rooted hesitancy. There is a lot of people willing to get the vaccine if they have their questions answered, which is why I'm skeptical, frankly, that incentives like cash payments are going to work. Because right now, the holdouts here have questions. They don't want $100. They have questions. And we need direct engagement from trusted, authentic messengers. We don't have enough of those. We need to find more docs, pharmacists, Nicolle. So much of this depends on pharmacies giving allocation. We need to empower pharmacists, because a lot of people trust their pharmacists, frankly, and have more engagement with their pharmacist than with their medical provider.
Tell me what some of those questions are that you've answered and successfully put someone over the edge and convinced them to get vaccinated.
I think the biggest one, especially for young people, is this threat perception issue. It's so difficult. But for 18 months, you and I and others have had conversations about who is most vulnerable. And what we've implied, either directly or indirectly, is that it's mom and dad or grandma and grandpa who will end up seeing me and my colleagues in intensive care units across the country. That message has gotten very clearly to the teens and adolescents and young adults across the country. The threat perception issue is vital, which is why I think I've personally leaned into what my colleagues who've tackled tobacco cessation as a pulmonologist have leaned into so successfully to target anti-smoking. Graphics, visualization, storytelling, to make the threat clear that this is, and I know some folks don't like me saying this, but that this is COVID-21. This is not COVID-19. The assumptions of 2020 no longer apply if you're young and unvaccinated. So that's number one. Number two, I hear this frequently, this notion that if they've previously had COVID, they're safe. And we've had to, and this is where it's tricky, because you get too technical, you lose people, but that the antibodies produced from the vaccine are different under the microscope and in the body than the antibodies produced from natural infection. Reaching people through storytelling, making them feel like you understand them, and then also kind of, doing a fast follow with the science, I found to be effective.